Welcome to Public Health on Call, a new podcast from the Johns Hopkins Bloomberg School of Public Health. Our focus is the novel coronavirus. I'm Josh Sharfstein, a faculty member at Johns Hopkins and also a former secretary of Maryland's Health Department. Our goal with this podcast is to bring evidence and experts to help you understand today's news about the novel coronavirus and what it means for tomorrow. If you have questions, you can email them to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Today, Stephanie Desmond talks to Lucia Mullen and Dr. Crystal Watson of the Center for Health Security at the Johns Hopkins Bloomberg School of Public Health about their new toolkit that makes it easier for business owners to understand all the risks of reopening and to take steps to mitigate them. Let's listen.
Thank you both so much for joining me.
Thanks very much.
It's our pleasure.
Lucia, I'd like to start with you. If you wouldn't mind, please telling me a little about why you designed this report and what does it provide for businesses?
Yes, thank you. So we actually started thinking of this report and the idea of making it more business orientated through some of the work we did for the World Health Organization. Dr. Watson and I were building a lot of risk assessments for their mass gathering groups in the context of COVID-19. And through it and some of our other contacts, we heard that many businesses, especially as we're entering this next phase of kind of lifting those social distancing measures, were wanting to figure out how they could begin and make sure that they could do it in a very safe way, but were uncertain what they needed to consider. So with that, we figured it would be great to develop a tool that they could use to help them identify where their vulnerabilities are, where the opportunities of exposure that their operations have for spreading COVID-19 are, and what are the types of modifications they could put in place to reduce it, and really try and help them have these plans in place before they consider reopening.
It seems like this toolkit would be really helpful for maybe sort of smaller businesses that are having trouble finding clear guidance in their jurisdiction. Is that the idea?
Yeah, we've actually created it to try and address all types of business, but obviously have it, really user friendly so that those small mom and pops type stores or single type businesses could use this, and those that might not have the vast resources to be able to put in some heavy modifications and completely change their structure could identify some very clear guidance from this that could still help them reduce their risk and really find it beneficial.
So I understand that you could sort of say where would maybe like a gym start versus a hair salon in this type of work?
So as with most of the risk assessments that we've been doing, the first thing these businesses need to do is identify where their vulnerabilities are. So we know that the virus can be passed by person to person, which is human to human spread, or object to person through fomite transmission. And so we developed some questions for our risk assessment that would really help the businesses identify what type of interactions they have. It wasn't also just the number of interactions or the number of people that they interact with, but the quality of that interaction. So some of our questions included, are you interacting in a high density? Is it for a long period of time? Are you touching your employees or your clients? Because those add additional risks. So for somewhere like a business that was a gym, let's say, it might include some of our questions asked if they have high-touch surfaces. So obviously, if we're using weights and that's being passed from customer to customer, that would be a high-touch surface. So that's something that they could target. And then as they go through this, we've got some modifications. Are there ways, self-cleaning options they could have to limit that risk by ensuring that these high-touch surfaces are cleaned and disinfected regularly? Are there ways that we could move to outdoor settings instead of inside ones? So could exercise classes be done outdoors because we know that would reduce the risk? Could class sizes be limited so that there are not many people, which would address the density issue?
Crystal, I'm curious. I guess this sort of all goes to the idea that even though places are reopening at different paces, different jurisdictions are doing different things in order to reopen, that doesn't necessarily mean that all businesses are in the position to be open. And this is to help them.
Yeah, this is really to help them, as Lucia said, understand their kind of baseline level of risk and then go through the options that they might have to modify their business or take mitigation steps that could reduce that risk. And so not every business will be able to make these big changes, like actually installing barriers to keep people apart, to reduce the risk of spread. But there are steps that every business can take that can reduce their risk. So if it's just having employees observe wearing of personal protective equipment like these cloth face coverings, having customers do the same, modifying the workflow, modifying the operation kind of tempo or when people arrive to work. These are all things that most businesses can undertake, even if they don't have the funds or the capacity to make physical modifications.
And you've made this into sort of checklists, right? So this is really meant for anybody to be able to do this. Is that right?
Lucia did a really great job of making this so easy to use. So a business can walk through their risk, walk through the flow chart of how you use the tool, and then go through the various modifications or mitigation measures that you can take. And so, yeah, it's incredibly easy to use. Thanks to her brilliance at putting a really great tool together.
Well, Lucia, I'm going to ask you some more then about this. I see that you talk about two categories, right? There's modification measures and mitigation measures. So could you tell us what each of those mean and then walk me through how you might decide which ones to use?
Yeah, so there's actually a four-step process to this whole toolkit. The first is the risk assessment, where you're identifying what your business's normal operations are and how risky they are for spreading COVID-19. The second is what we're calling the modification assessment. So these are what are the big changes, the kind of big ticket items that you could do to reduce that risk. We focus more at that operational level. Then you follow it up by finding your overall score, and finally with that checklist that Crystal mentioned, which are your mitigation measures. This is more focused on the individual level. So these would be things that could help increase the safety of your clients, of your employees, of your customers. So while increasing the safety of those will also help reduce the risk, a lot of them are kind of the more minor things, such as making sure you have communication strategies in place, that you've trained your employees on how to effectively clean and disinfect, that you have changed your shifts so that employees are only interacting with the same set of other employees rather than mixing out all of your different employees, that you're wearing masks if you can inside and whatnot. So while we certainly recommend you do everything, those smaller mitigation measures are something that businesses can pick and choose from depending on what is relevant for them and what they have the capacity to put in, and then build their implementation strategy around it. Whereas the modification measures are kind of the larger items, such as reducing the number of people that are interacting, reducing the time that they're interacting, completely limiting or restricting your travel, that would really make those huge reductions in that overall risk that you can have in spreading COVID-19 if you choose to open.
And of course, we have to say nothing's risk-free, right? Except for staying home.
No, and that is something we really try to push with this toolkit, especially in the disclaimer, as with any risk assessment, that we can never get down to zero risk. So there is always a chance, and we really recommend that companies don't just do this whole process once and be done with it, but they continuously update it, because your risk threshold of what you would consider an acceptable risk of reopening may change as the outbreak changes itself. As we've seen in many different cities, it can change quite rapidly and scale up very quickly. And so then you may need to consider closing down again or restricting your operations for a period of time. It also, while this tool has been developed to really help the businesses, they first and foremost must follow their state, local, and federal guidelines, as this does not in any way dictate that.
And Crystal, I would think that customers, clients, in the end, it's really to make them feel comfortable coming back to these businesses. Is that right?
Yeah, it's both about the customers to make sure that they are protected to the extent that they can be, to make them more comfortable in returning to business, but also for the employees of the business. We've seen that there are workplace settings that make transmission of this virus much easier. So we've seen in the news, the meat processing facilities have had big clusters of cases, or long-term care facilities often have these clusters of cases that are deadly to people. And so it really is not just to protect the customers, but also the employees who may be at higher risk. They may have risk factors as well. So we want to do both.
Then I was also thinking, we talked about surfaces and we talked about face coverings. And I feel as though in recent days, we've been hearing there's been more of a shift toward worrying about being exposed by other people as opposed to surfaces. And I wanted, Crystal, if you wouldn't mind addressing that. Is this really a shift, or is this just a new focus of some sort?
I think it's an evolving outlook. So as we learn more about transmission and where transmission occurs most frequently, I think we're seeing that a vast majority of the transmission events happen from person to person. That doesn't mean that there's no risk from transmission from object to person, but a recent study, for example, showed that COVID-19, that the SARS-CoV-2 virus is actually deactivated out in sunlight fairly quickly, so within minutes as opposed to hours, which we've seen other studies on different surfaces. So we're learning more as we go along here, as additional laboratory studies are done and observational studies of outbreaks. So it's going to be an evolving view.
And Lucia, do you see businesses embracing this? Have you spoken to folks who are using it?
Yes, quite a few. So one of the first things we did before we launched this tool was we actually sent it out to a variety of different businesses, both here in the US and internationally, to have them pilot and stress test it for us. After receiving quite a bit of comments from them, we changed the structure slightly to adapt to some of the considerations we hadn't originally kept in mind. And then since then, it's gone back out. And here in the US, it's been very widely picked up, particularly by small and medium-sized businesses, as a tool that they felt, while maybe on the initial lookout was quite cumbersome, as soon as they got into it, they really felt it walked them through the process and really helped them define what their strategies are. It also gave them a lot of confidence to start creating these plans, because many of them do want to open up, and now that they're starting to be allowed to, they feel they should, but they want to make sure they're doing it in such a safe way. And they were very apprehensive in the beginning on being able to provide a safe environment both for their employees and clients. So we've received a lot of positive feedback in that sense.
Well, Lucia Mullen and Crystal Watson, you've really given us a lot to think about. Thank you so much for being here.
Thank you for having us.
Thanks a lot.
Thank you for listening to Public Health on Call, a new podcast from the Johns Hopkins Bloomberg School of Public Health. Please send questions to be covered in future podcasts to publichealthquestion@jhu.edu. This podcast is produced by Josh Sharfstein, Lindsay Smith-Rogers, and Lamare Morales. Audio production by Niall Owen McCusker and Spencer Greer, with support from Chip Hickey. Distribution by Nick Moran. Thank you for listening.